Good morning, everyone. This is Anna Siefken. I'm so glad to have you joining us today. You are joining a webinar that's going to speak to transportation energy. We have some exciting guests today. But before we get started on this webinar, I wanted to say a quick thank you to all of our frontline workers. As this pandemic continues, we understand the importance of all the work that's happening. We're having a really important conversation about transportation energy and how we should be thinking and planning. But there are many people who are doing things, keeping the lights on, keeping the trains running today. We just want to say thank you. So the Scott Institute is a hub of energy-related research at Carnegie Mellon University in Pittsburgh, Pennsylvania. And we do things like programming. We have a lot of opportunities to bring together thought leadership. Many of you have seen work in person that we've done before. This webinar series is our version of keeping the conversation going during this pandemic. So the webinar is intended to bring together informative voices to talk about insights that we all need to be considering as we think about pivoting after COVID-19. And this does include all of the other sorts of inequity and disruption that we've seen in the past few weeks. So as I mentioned, this is Reimagining Transportation Energy in 2020 for Equity and Resilience. I want to say a special thank you to the Port Authority and to Populous who are joining us today. On August 20th, we are doing a session on energy and equity, developing a clean energy workforce. On September the 3rd, batteries and energy storage, which is a fireside chat with Jay Whitaker. On the 17th of September, we're talking about supply chain impacts on energy business valuation, an important topic during COVID. And a special note, particularly for all of you students, between September 29 and 30, we will be having our CMU VentureWell virtual energy hackathon. So should anyone have any speaker suggestions or future panel ideas, please email the Scott Institute. You can email me. Many of you have my email address. And with that, we are now switching over to our panelists. And I will do a couple of quick introductions. And apologies again for not having the right view on this morning. So first we have Regina Calillo, who's the CEO and founder of Populous, which is a data platform for cities to manage the future of mobility. Trusted by leading cities and the world's largest mobility operators. Data from shared electric scooters, bikes, and cars, and delivers cities with digital tools to design new policies for their curbs and streets. Corey Harper is an assistant professor in the Civil and Environmental Energy Department at here at Carnegie Mellon University, and also has a co-appointment in the Heinz College of Information Systems and Public Policy at Carnegie Mellon. His research focuses on climate resilient transportation systems and automation in transportation. He uses cost-benefit analysis, modeling and simulation, and machine learning to ask questions such as, how does rain impact congestion on the transportation network? And how could robocars impact the spread of COVID-19 for essential workers? Next, Katharine Kelleman. She has the pleasure to serve as the Chief Executive Officer of the Port Authority of Allegheny County, which is the public transit system serving the Pittsburgh region. She's responsible for the operations of a 700 vehicle bus fleet and an 80 vehicle light rail system, which provide service to a total of more than 220,000 riders a day. So the Port Authority of Allegheny County is the 25th largest public transit agency in the nation, supported by an operating budget of more than $460 million and a capital budget of more than $250 million. Port Authority's 2,600 employees operate, maintain, and support service to all of those riders, more than 64 million rides a year. And last but not least, we have Kostas Samaras, who is an associate professor in the Department of Civil and Environmental Engineering and affiliated faculty in the Energy, Science, Technology, and Policy program at Carnegie Mellon. Costa analyzes how energy technology and infrastructure systems designed to affect energy use and national security, resilience and climate impacts, economy and equity outcomes, and life cycle environmental emissions and other externalities. Phew, it was a mouthful this morning. Such a distinguished group of guests that we have with us. So I want to start with the first question, and I do want to encourage all of you that we have a Q&A section. Please do put your questions there today. I see that there are a lot of you who are also chatting. That's great. The Q&A is where we'll pick up those questions. So I want to start first, and I'm Katharine. I actually am going to pivot to you first because I know there's a lot of interest in how our transportation system is doing locally. So the real first question is, what has been the global impact on transportation during COVID-19 on ridership, workforce, safety, energy usage, emissions? So what are the implications both for short-term and long-term resilience?
Anna, first, thank you for letting me join the panel today. I feel like I probably have the least to add, so I'm looking forward to listening to it. And thank you to everyone who is dialing in and joining us from wherever you are today. So in a lot of different things, I was talking to someone the other day at one of our garages, and he said, you know, this pandemic didn't do X, Y, Z. It just showed what was already broken. And we've heard iterations of that in a whole bunch of different conversations, you know, starting back in March. So what about, you know, the tenuous situation for renters and housing? What about the cost of college? What about just trying to get to your job, depending on where you land, on being able to have enough money to control your transportation, for lack of a better expression. So the pandemic for us is highlighting what we probably should have been rethinking anyhow in transportation, and it's a good time to do that. Locally at Port Authority, in January, we kicked off our first system plan. We have not had our own system plan. I don't think we can find a plan on the shelf. And clearly, if you don't know where you're going in 30 years, how do you know the next 5 years are right? And when you're trying to enact big change and improvement in the transportation network, you can't just think about it a year at a time. So we had just started this process of coming out to communities and asking folks what they value in their transportation, what was important to them. You know, often we end up listening to fancy presentations about autonomous drones that will fly you over the Monongahela, blah, 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 blah. And the folks who are using our systems really just want a safe, reliable, respectful, clean, comfortable ride that gets them somewhere in a reasonable amount of time so they can go on living their life. So we had started those conversations, and we've kept that going through the pandemic. It's been a really different way to try to get input, and we're still struggling for the ways where we can replace some of this face-to-face interaction so we can hear from folks. And you know, we don't hear so much about trains going all over. We hear 24-hour service for essential workers. We hear more frequent service. So if you live close to a bus line, you know it'll be at least every 15 minutes in rush hour. You know your weekend frequency will be some guaranteed level. More conversations on not just extending the East Busway, but improving the quality of the shelters, because some of these shelters are really nice, right? Some of them are stations, some are concrete bunkers, which are, you know, very forbidding and not comfortable to be at and don't make me feel safe and make me feel like my neighborhood might not have been important enough for that investment. So we've had different conversations on planning. At Port Authority, all but one of our routes serve either a grocery store or a medical center. So we've been talking to UPMC and Allegheny Health and Highmark about where all their locations are to make sure that folks who need to get to work can get there. Because this is what we do. There would be no city, there would be no urban region if we didn't have transportation connecting all the dots right now, right? No one could get to Giant Eagle or Save-On or wherever they're talking about going. No one could get to any of these services. So we've really been looking at how to preserve that sort of, I don't want to say bare minimum, but preserving that critical service. We call it coverage service, places where we are the only way that folks can get around. And we know we can do better on different connections. We've strapped down our service based on manpower we have. And so for instance, we see the eastern portion of the county is not as well connected when we don't have as many vehicles as we need to accommodate demand. Ridership-wise, the 13th of March is sort of our inflection point. So we were going okay, and then this happened for ridership. When the pandemic first hit, we were probably at 20% of previous ridership. System-wide, we're back anywhere to 35 to 40%. Some routes are at 10%. These are commuter routes. Some routes are almost at 90% of ridership. These are more in the urban core type of routes. Our train service has been coming back, but we see fewer people are going to work and fewer people are taking discretionary trips. And I think we have to talk. We're talking about equity. We have to talk the impact for parents and working families, that if your kid is at home, you're not going to be going into work. So that is going to impact our transportation too. And of course, my dog has chosen to bark right now. So let me mute real. My name is Lollipop. I'm so sorry about that. Working life. I have a kid upstairs too on the iPad. For our workforce, we wanted to make sure from the very beginning we were doing everything we could to answer what questions were answerable, and we were as safe as possible. We had a pretty generous leave provision right out the gate, that if you had to get tested, we would cover your sick leave as administrative leave if you had to quarantine, clearly if you were positive. Because what was the other choice? If folks thought they had to come into work because they didn't know how much sick leave they had, and they gave somebody else COVID, or they gave it to a passenger, what would happen then? And you know, a microcosm is one maintenance department ended up getting 9 people. All of them had COVID within a 3-week window. They'd all been just in really close spaces in a maintenance office. And that took that whole garage down to a skeleton crew. We could do the bare minimum of maintenance. If we'd had 2 more people get sick, we would have had to shut the garage. And how do you serve the county with one garage shut? You can't do that. So we've wanted to make sure that our folks knew that they were taken care of and they could recover and they didn't have to risk their health. So that's also meant fewer people at work. So that's led to a smaller schedule so we could line up with the folks we had. And no vehicle goes out if it hasn't been sanitized before. So every bus and every train that you see has had a deep clean the day before, sometimes that day also. We're getting our stations every day as well. And that's a manpower issue. We want to make sure we can cover that. I'm going to defer on the emissions to the other panelists, because other than being able to see stuff I couldn't see when March rolled around, that's all I have. But I'm going to shush and push it back to the rest of the panel.
So who would like to go next? Thinking either about emissions or just other disruptions that might have happened.
I'm happy to dive in. So Regina from Populous here. You know, one thing that we saw at a high level was pretty significant declines in public transit right at the beginning of the pandemic, and I think continuing now. And from an emission standpoint, I think one of the key concerns among transportation researchers and policymakers who have been concerned about the growing transportation emissions, which have been the largest growing sector in the US and then also in many regions, is that we're seeing a faster return back to vehicles, and that's happened. The return to driving in a personal automobile has happened faster than the return to public transit and other services. And that's particularly concerning. So if we have more people purchasing cars, more people deciding to drive instead of taking public transit, we're going in the wrong direction when it comes to transportation emissions. I do think that, and I will put it out there, I am not an epidemiologist, so I am reading information just as many of you all are, but I am concerned that some of the concerns around riding public transit and transmission may have been a bit overblown. I'm a Californian. I'm out here in California. I love Californians, but I'm fairly certain that a lot of the cases are rising because of backyard barbecues and people hanging out, and not because of people taking public transit. And so I think we have to keep in mind where our priorities are as a society. And as we think about our transportation system and making it resilient, how can we invest in the outcomes we want this year, next year, and 30 years from now, and encourage the behavior that we want to ensure that we're not heading down the wrong trajectory when it comes to our climate and transportation.
So I'm going to add on what Regina was saying. I know the Atlantic has had some articles recently on, you're not getting it off transit. And this is a message we try to get out with transit. It's a little tricky. We're glad we have the Atlantic now, because previously we had stories from France, from South Korea, from partners at various places in China. And we were pointing to that and saying, these studies are showing that transit is not how people are getting COVID, but given that those countries had a very different response than we have, we didn't want to make the point that you don't get COVID from transit. And then the next question of that be, but that's because these countries are doing X, Y, Z, which the US isn't doing. So now having the Atlantic come out and say, hey, it's not transit, it's these other things. It's that standing in front of someone and talking for 15 minutes. And that's made it much easier for us to make the case that wear your mask and don't spit on people. That sounds trashy, but that's what we have. But we're still cleaning everything like crazy, even though the data is showing it's more of folks talking. We still know that people want to see the bus clean. I mean, clearly I do. You want to smell like the lemony pine smell my bus is clean stuff, but that's a great point, Regina. They're going back to cars. But I think that's the same thing as folks who are saying, oh, I'm going to flee the big city because density, right? Density is what's causing COVID to go on. And Iowa, again, has had a worse outbreak and per capita outcome than Seoul, South Korea. And so if density were the issue, I think Iowa would be in a different position. No disrespect to Iowa, just an example.
Yeah, so I mean, I think that in the short term, you know, like Katharine and Regina said, we'll probably see some decline in ridership just because of a lot of it has to do with fear, you know. When I think of standing next to somebody, being close to somebody, at this point in time, I probably don't want to do that, you know, just because, you know, we just don't know what will happen if I stand close to somebody I don't know. You know, what if I go to CMU? Some of these buses are really packed in the morning. You know, you can't get a seat. Everybody's, it's maybe the capacity of the bus is 50. It's 65, 70 people on the bus. You know, it's barely any standing room. You know, those conditions right now, you know, they can be a little scary, you know. But maybe in the medium term and in the long term, you know, once vaccines come out, once we start to, know more about how the virus is spread, you know, and, maybe people will be a lot more willing to, use these forms of transportation. And I think it will come back at some point, but I think there's a big fear factor right now that just comes with being really close to people that people have to get over at some point. And, you know, at this point in time, people don't necessarily have to go to work, you know, so if you're going to go somewhere, you know, likely you're going to drive or take a bike or walk or something like that. But as we return back to normal, I'm sure people are going to have to start taking transit, you know, and wear masks.
Yes. Okay. So wear a mask, right, Corey? Wear a mask. And a centerpiece for us, or at least since I've been here, I'm sure ahead of that, is when we treat transit like it's a last resort service, like, you know, people can choose not to use it so we don't have to do X, Y, Z, then we're doing our job wrong. So we don't do it for the guy in the tie. Our core customer in many cases is a Head Start mom, and that's not an economic statement. It's she's using us 60 times a week. Any business that doesn't concentrate on their 60 time a week consumer and is chasing after a new person to consume the service 5-10 times a week, that business isn't going to go really well. So can we change the way that we, the agency, are rolling out service to make sure that we're addressing all of these issues for the folks who are there now, and the people who are riding feel like they are important enough, their safety is important, their health is important, and it's not like, oh, I'm stuck on trashy transit. So that's a big thing for us in our messaging and in our cleaning and how we hope to be interacting with our patrons.
I think if you look at the data globally, you know, we're in the midst of a ongoing and unmitigated pandemic. Kind of March and April was the high point of global lockdowns, and transportation was the sector that felt it the most. But even inside of that kind of global lockdown, total transportation activity and emissions were down about 1/3. And so that means that whatever we bounce back to, you know, can't look like what we had before, and it can't even look like what we have now, right? If we're going to have to get to a zero carbon energy system and zero carbon transportation system, if a global lockdown only shuts down 1/3 of emissions, we're going to have to transition to new strategies and new technologies, and that includes very highly more accessible transit and walking and biking, as well as a decarbonized electricity grid and a decarbonized transit fleet. I'm very grateful to our Port Authority CEO, Katharine, for ensuring the safety of the Port Authority workforce for the essential workers that are on the bus and for all the passengers that in the greater system. We just don't have in our cities the space to not have public transit. So there was this conversation going on a couple months ago, as Katharine was alluding to, of, well, maybe we're just all going to drive now. And there's just not enough, there's no way that a modern city and modern society could function if everybody's driving to work in a single occupancy vehicle.
So I'm hearing some themes around behavior change. So I'm not exactly asking anyone to pull out their crystal ball this morning, but what do we actually think it's going to take for people to feel comfortable again? Or how will we address the emissions associated with these different decisions that people are going to make?
I can kind of chime in at the beginning. I used to be a travel behavior modeler. I was a former academic, so thank you to Costa for reaching out for me. We know each other from those former days in my career. And I think that there are a lot of trends that had predated COVID that we're seeing accelerate. And the question is, how much will those significant changes remain in terms of their trajectory? So for example, one of the big trends had been telecommuting. More and more people telecommuting a few days a week. Now we're basically doing it 24/7, 365 days a year for some types of workers. And the question is, what portion of that will remain? Because that does have a significant impact on travel activity. And I think that we are going to see that trend continue, and the question is just how much will there be? Another is conference travel. So, a lot of the events that we used to all probably attend here are obviously not happening in person. So to what extent will airline activity come back to where it used to be? When I did my PhD at MIT, actually in engineering systems modeling, my role was to help build forecasts for the FAA to understand climate emissions of the aviation industry. We did not have a global pandemic scenario that we had predicted, I will admit. But this will materially impact the trajectory of the airline industry, certainly, and that was a growing portion of the transportation landscape. And then on the reverse side, so those are all activities that would reduce activity and reduce emissions. But clearly we see this return potentially to automobiles, which is concerning, reductions in public transit. But on the flip side, in the urban environment, we are seeing pretty significant returns back to micromobility. So Populous is a platform that ingests data from shared mobility operators, shared bikes, scooters, mopeds, and also cars to help cities understand how the services are being used. And I will say we've seen pretty significant bounce backs in micromobility. Bike sales are through the roof, up 70%, in the United States, I believe globally as well, from a year ago. And we're seeing a pretty significant return to micromobility. And I think that when we look at urban transport, fundamentally what we need are multiple options for people to get around without the need to own a personal vehicle. In addition to public transit, there are a lot of complementary modes that enable people to have more options.
Regina, how's micromobility been deployed in low and middle income neighborhoods, and how can we increase the equity and justice concerns around micromobility?
That's a great question. So we've seen pretty significant efforts on the parts of cities to help ensure that those services are being equitably distributed in low income neighborhoods and areas traditionally underserved. So most cities have a micromobility program and a set of policies that require that X% of vehicles be placed in those neighborhoods. And then through our platform, they can actually monitor, are they complying with those policies, and can track how many trips are actually coming to and from those neighborhoods. So it's pretty interesting because I feel like with micromobility, many cities leapfrogged beyond, where they would have liked to have seen similar data and information for Uber, Lyft, delivery services, and so forth. They can see all of that for micromobility, and they can help encourage that those vehicles be made accessible. I think, though, that we also need to consider incentives for those programs, because when we look at the transportation system right now, micromobility in many ways has been penalized, more so than, personal automobiles. It's being priced heavier in some cities. And so we have to put in context, what do we want our outcomes to be? Are we fairly pricing or regulating services that could provide a net positive benefit more than other services, such as personally owned vehicles, that we don't?
Just to, kind of continue the micromobility conversation from what Regina said, from an equity standpoint, I think we still have a lot of work to do. A lot of the bike share systems, especially now I've looked at the one in Pittsburgh, a lot of the stations, the dock stations, they're close to shopping centers, they're close to transit systems, and they're not necessarily located in our low-income neighborhoods or our transit deserts. And this is supposed to be a mode of transportation that links people who don't have access to high-paying jobs to transit, so that they can maybe get to some of these jobs that they didn't have access to before, or to healthcare, things like that. And not having access to these things really limits their upward economic, socioeconomic mobility. So I think that there's a lot of work that we have to do there. So now that especially during COVID, when people weren't driving, that was probably one of the best times to start reimagining, what it should look like when we get back, right? So, bicycle infrastructure is a really big thing, right? Where do we deploy it at? Where should we prioritize this at, so people are, maybe taking this to the bus and, using that as a first mile transportation, or maybe for some really short distance trips, just taking this the whole way. Instead of getting in a car, you have your, you have your cold start emissions, things like that. And, but I thought that, during COVID was a really good time for us to really reimagine, okay, nobody's really driving right now. How can we repurpose our streets, our parking lots, et cetera?
Well, and quality of life too, Corey. I think that's an excellent point. I know, like in the first 2 weeks, when everybody was, if you could work at home, you were working at home, kids were at home. I saw my neighbors more. I heard birds because there was less background, transportation noise. Airplanes it's not like planes waking me up, but they were just not up there. And it was a different way to look at the life that you had. Now, I understand that comes from an awful lot of privilege, because I have the ability to work from home. I have the luxury of my husband is a stay-at-home husband. Yes, living the dream. So there were two adults in this household helping take care of the kids, et cetera, et cetera. But it was a different way to think about how you live. Now, I also live in a neighborhood. I had the ability, when we moved here, to choose a place where things are walkable. So like yesterday, I walked over to my eye doctor. I have sidewalks and I have good tree cover. And tree covers, something we're reading more about, that you want to look at how neighborhoods are going to handle climate change. More affluent neighborhoods have more tree cover, and so the temperature is lower, your heat sink effect is lower, but then people aren't just walking outside when they're with nothing over them. And it might not be a big deal in Pittsburgh, which has a lot of trees, but I'll tell you, when I was in Tampa, I was there for 8 years, and you wouldn't go anywhere if you didn't have an umbrella. I mean, there's parts of this country, and as climate change continues, it's going to get worse. But there's places where it's just not having an easy way to get from A to B. It's not just a sidewalk. It's, if the sun is beating down on you, it's a less comfortable experience. Plus, imagine walking home with your groceries when it's 85 or 90 degrees outside. I mean, do you buy chicken? Do you take a chance you're going to give your family salmonella? And having tree cover can impact that. So it is a good time to reimagine all these different things. Like, oh, this is great. How do we get this to everybody? And your point on micromobility and equity, I want to touch on that a little bit. My anecdotal stuff is dated, but we also in Tampa did a pilot where we did our own ride share, because we just couldn't get the coverage with buses. It was just not cost effective. And then for paratransit, if somebody had some level of disability that made it that they couldn't use the standard buses, they had to call a day in advance, and you had to book an hour on this side, an hour on this side. So going to the grocery store, it was terrible, but that same person could call Lyft and go to the grocery store when they wanted, leave when they wanted, and pay almost the same amount of money out of pocket. So we looked at how we could bring ride-hailing services to town, and we spoke with Uber, and we talked to Lyft and a couple other startups. This is like 2015, so it's been a minute, right? But we needed to know that there would be accessible transportation that would be available in the same window. And these operators needed to take cash. And that precluded, Lyft and Uber just weren't gonna, they bid, but they were non-responsive because it's not worth it in their business model to do these things. So when we have these mobility improvements, which can be incredibly helpful if you are trying to get somewhere at 3 in the morning, or you don't have the density in your neighborhood to have that many people take that trip, what are the structures that we can maybe address? And in many ways, the transit agency takes on the role of the equity insurer. So maybe somebody else has the ability to get to ride hailing, but the incentive on the transit agency needs to be make sure everybody can take advantage of those services and have the same experience.
And the Port Authority does a good job with accessibility, but let's be real. I mean, we're 30 years after the passing of the Americans with Disability Act. And 3/4 of New York City subway stations aren't ADA accessible. You know, half of Philly's, half of New Jersey Transit, and you know the transit network. If it's not accessible for those with disabilities, then it's not going to be the backbone of our modern society. And so we have to be able to ensure that not just that the bus stop is accessible, but as Katharine was mentioning, the sidewalk to the bus stop, right? And the stores along the way to that bus stop. And I think that, you know, we're in a period right now where we need to be massively reinvesting in transit, not just in rolling stock and capital, but the entire transit shed. And we, you know, Regina and Corey and I all work on, you know, new fancy robocars and cool scooters and e-bikes. You know, how about like a sidewalk that works, right? And a curb cut and signals and striped crossing, pedestrian crossings. A lot of the infrastructure that has been neglected and disinvested in urban and rural communities is really, you know, put us in the position where COVID has, as you said, Katharine, illuminated all the kind of the ways that we weren't prepared for this.
Right, and you know, access for one is access for all. And so as we were looking at not just in the system plan, we had been doing a lot of work on rebranding, just wrapped that up in time for COVID. So we got really fantastic information about what do our passengers value, what are they looking at, what's, you know, how do they want to experience transit. And we were really saying, we're just going to make universal design be this principle that had to be in there, that anyone can get into these things. And so we have a lot of folks coming to UPMC because they have macular degeneration, a lot of eye concerns. Making it easy for those folks to figure out the fixed route network to get there is helpful for folks who are new to Pittsburgh and don't know what these streets are called, or helpful for somebody who is, you know, a senior and they're uncomfortable traveling by themselves. A platform which makes it easier to board for someone in a mobility device changes the life of a parent with a stroller, because right now, if you take the T, you can take your stroller onto the vehicle and not fold it. But if you take a bus, we have you, for safety reasons, take your kiddo out and fold up the stroller. With one child, that's a challenge, but with 2 children, this is like American Ninja impossible. I mean, like you can't do it. And by keeping those standards, all these, you know, we're telling young families that they can't really take transit for 5 years. And it's hard to explain how crazy that is if we want a network where everybody can get into it. So low floors, better print, easier to read, easier to decipher, easier to access. I mean, all of this together, it's every single one of us can benefit from it. So but you point out when New York, and we're talking Philly, we have T-stops that aren't accessible. They were built pre-ADA. What does this tell you about the state of investment in infrastructure in the country, that so much of this is well over 30 years old, that it is still a barrier? We're not making the investment that we need. It strains credulity to think that you should drive a train car for 30 years. I mean, just if you have normal people and wear and tear on this thing, 30 years? I mean, where else do you go that you see a public transportation vehicle that's 30 years old. Like our train cars we bought when Borderline by Madonna was a top #1 hit. And like, there's people on this webinar who didn't exist when that happened. So anyhow, I'm starting to preach about that.
I still think Madonna's great, for the record, but
Yes.
I 100% agree. And I think that one of the things that's been really interesting during this time that we've seen is that many cities are really rethinking how we use public space. And a lot of citizens, I think, are questioning how we allocate public space in addition to these maintenance issues. There are a lot of cities saying there are street spaces that we should be opening to prioritize bikes, pedestrians, to make more space for citizens. And so streeteries have become very popular in pedestrian malls in order to make space for outdoor dining so restaurants can survive through the pandemic. And I think it's interesting that we have, in this moment, at least taken that time to reflect on how that space is being used, how we can maybe do better with that space from not just a maintenance perspective, but how do we allocate it? How do we price it? I was just in a webinar yesterday on pricing the curb, and I think of that as an extension of road usage pricing. So we don't price our streets. I don't know why Americans think that we should pay for water and utilities, but all of our roads and all of our infrastructure should be free. But I think we're all questioning that now. A lot of cities are looking to reshape how that space is used, price accordingly. And then it also enables us to make those reinvestments into sidewalks that need to be repaired, into public transit, into ensuring coverage in areas that have been underserved. So I'm optimistic that we're seeing change that will move us in the right direction. And, you know, just I'm glad to be and grateful to be able to work in an industry that's helping to support cities and transportation systems that work for everyone in the future.
So a quick note, we are coming very close to time. Interesting. You guys, what an incredible conversation. Those of you that are asking questions, please continue to put your questions in the Q&A. What we're going to do is we're going to ask our guests to help us write up some of the answers to these questions. So if you submit a question, we're going to see if we can get some details to you. I know that's going to make more of you ask more questions, which is good. But we do have quite a few that are coming in. What I'd like to do is ask you, we've talked about behavior, we've talked about some of the ideas that you all have about, you know, how to use our space differently, and the importance of access. So is it policy? Is it funding? Is it a combination? Like what's the one thing, and I hate to say one thing, what are the one or two things that you think we should really be focusing on as we're looking into, I'm going to call it 2021 now?
No pressure, huh?
It's the big idea. We want to see, where are the insights? What should we be leaning into is really the question.
I'm super biased, but I come at this from a former transportation economist perspective. But I do think that one of the key things I'd like to see us lean into is pricing, congestion pricing, curb pricing, basically road usage pricing that allows us to more effectively invest in the services that we need to invest in, but also disincentivize the behaviors that we want to disincentivize, which are resulting in increasing pressure on our planet. One of the reasons why I decided to focus on transportation in the first place is I had a strong interest in climate and energy issues when I entered my PhD and realized transportation is this really tough nut to crack. It is very, very hard to curb transportation emissions, and it's because it is driven by lots of individual behaviors that are very, very difficult to manage from a policy perspective. So I'd like to see a lean into road pricing.
One thing I'd like to see is, you know, cities have an issue right now with safety, right? So about every hour, there are about 2 pedestrians or cyclists killed in a car crash in a city. And this happens every day, right? So I think as we, you know, start to look towards smart cities, you know, we need to, you know, put people at the forefront and begin to design our cities that are safely. We talk about people walking, biking, and maybe as people get out of cars, this will improve, but I don't think a city is livable if people are, choosing to walk or bike, and these people are, getting into crashes, So I think that safety, is something that we need to start thinking, more strongly about. How do we protect the people that are, making some of the right decisions,
I'd say for me, the lean in is, okay, and the dog was barking, she's in my lap, sorry. I think the lean in is demand the dignity that our transportation is entitled to. We don't, to Regina's previous point, yeah, we accept that we're gonna pay for water and we're gonna pay for electricity and we're gonna pay a lot for healthcare, but there's the perception that all this public infrastructure should be free, like no user fee incurred, to completely support this single car network that Corey is talking about, that all of us have pointed out is not meshing with the great use of a city. To Costa's point, there's 44,000 parking places downtown and over 100,000 jobs under normal circumstances. So let's swing for the fences, but let's not apologize. Let's not, I know everybody in making this decision would rather have a single car that they're taking everywhere. No, let's go in and look, the reality is Pittsburgh grew up, just locally, it grew up before cars existed. The city is designed to accommodate a walkable, livable life. And again, contrasting my experience, I spend so much less time in my car here than I did in Tampa, or even on the bus, because in Tampa to take the bus home was an hour, and here I can get home on 36 or in maybe 20 minutes. So my life is mine again. I get to see my kids and not just yell at them. I get to actually walk the dog when she's not barking at everybody. Why don't we just decide that that's what everybody is due, and hold our electeds or whoever is funding or whoever is making the argument that major institutions should get XYZ breaks so they're not contributing back into the infrastructure? Let's just go big with that dream. I mean, we've been going small and we've been getting crumbs, so go big. What's the harm in going big? Swing for the fences, you're gonna get something.
I love the idea of swing for the fences. I mean, I want people to be very clear-eyed about the challenges ahead of us with climate change and decarbonization, especially in the transportation sector, but we have to do it. And so thinking about the ways that transportation and infrastructure has caused inequity, and finding ways to ensure that the next transportation system doesn't do the same thing. It doesn't have to. We have the choice right now to choose what this next transportation system looks like. And I want people to think big. I mean, we have 250 million cars and SUVs in the United States. They're on the road for 15 to 20 years. Most of those will have to be electrified within the next 15 to 30 years.
Right.
There's 3 trillion vehicle miles traveled in the car fleet every year in the United States. How much miles are traveled by transit? 5% of that? 1% of that? No, I know I'm selling a product here. 0.15%. So we don't have to double bus ridership. We don't have to triple bus ridership. We're talking 20 times. And so what does that mean for a community? What does that mean for infrastructure? What does that mean for housing? Let's figure out a way to make this work for everybody this time.
And so with that, a great place for us to jump off today. We are committed to bringing you insightful commentary, and obviously our guests today are deeply versed, and I appreciate all of your time. As Katharine mentioned, she had a big phone call and she ended up coming to us today instead. So we appreciate you all giving us this 45 minutes. We want to get back to the rest of your day. I'm also thankful to Danielle for being here today and providing additional access. This was a request that came in, and apologies again that at the beginning I didn't quite understand the technology. So I'm glad that we've been able to provide more accessibility today. We're open to your comments and feedback, and we look forward to seeing you on a future webinar. So thank you again to our panelists. Thank you to all of you for spending an hour or so this morning with us, and we will see you at our next event that comes up.